Mrs. Margaret Renzian today.
So I was wondering if y'all could answer some questions for me about medicine to help treat my son's hemophilia.
Of course. My name is Meredith, this is Josie and Caroline, and we'll be your nurses and help you out today.
So the two most common drugs to treat hemophilia are aminocaproic acid, which is also called Amicar, and desmopressin. Amicar's main job is to prevent the breakdown of fibrin, which is an enzyme used in the clotting cascade. The clotting cascade is basically all the different clotting factors that help our blood clot. Amicar is going to help all of this work so the blood can clot better.
Okay, what kind of side effects do these drugs cause?
Some adverse effects can be seen when taken with Amicar are bradycardia, or we can also have a decreased blood pressure, buzzing of the ear. You can also have some muscle pain, arrhythmias, nausea, vomiting, and diarrhea. And after taking the medication, we monitor that blood pressure just to keep that in check, the effectiveness of the drug, and level of consciousness of your child, and any neurological changes. And we also monitor edema and leg pain so that we can eventually indicate whether there's a blood clot in the leg or not.
And desmopressin, DDAVP, is the main side effects. That is the worst side effect would be possible seizures, and it could also increase or decrease your blood pressure. It could cause flushing of your face, so just redness, fluid retention, back pain, and sneezing. Desmopressin is from the antidiuretic hormone in the vasopressin class. We need to monitor his urine volume, blood pressure, plasma factors, or coagulation factors needed to clot. Also assess signs of toxicity, which would be if your son was confused, having seizures, or difficulty urinating. The DDAVP can be taken by mouth, IV, or intranasally.
Alrighty, that sounds pretty serious. When would I know the best time to call my doctor?
You would need to contact your healthcare provider if the bleeding is not being controlled, if any severe nasal congestion occurs, or a headache occurs.
Okay, is there anything else I need to know about these drugs?
Yeah, it's just very important for your son. You need to make sure he's taking the medications as prescribed, contacting a doctor if any of those side effects occur, and then also just watching bleeding, making sure he's not getting up too fast or moving around too quickly, and not combining any of these with alcohol. And then, do you have any other questions for us?
I think I'm good. Thank you for all of your help today.
Of course.
Thanks.
Thank you.
Hi, Mr. Thomas. My name is Zoe, and I'll be one of your nurses today. I have two colleagues with me to help explain your diagnosis, along with some interventions that you can implement into your daily life to aid in managing hemophilia.
Hi, my name is Mitchell, and I'm going to be explaining the benefits and risks of physical activity in regards to hemophilia.
Hi, I'm Elise, and I'll be talking to you and answering questions you have anything about hemophilia across the lifespan or community resources.
Thank you all for coming. I was diagnosed with hemophilia when I was a child, but it hasn't really affected me until now. I'm 16 years old, and I feel like I can't participate in the same sports or activities as my friends. I feel like I'm different, and I don't know what to expect in the future. Can someone start by explaining what hemophilia is?
Sure. I recently read an article by Gupta and Shapiro about hemophilia, and I learned that hemophilia is a blood disorder. It alters clotting factors within the body, ultimately decreasing those clotting factors and making it easier for you to bleed. And when you do bleed, it's harder to get the bleeding to stop.
So how can I prevent bleeding?
You can prevent bleeding by adhering to the prescribed therapies ordered by your doctor and participating in safe sports and activities.
Okay, great. Mitchell, you mentioned you could explain the risks and benefits of physical activity in regard to hemophilia. Physical activity is very important to me, and it's something I do in my everyday life. I would like to continue to be an active individual, so can you explain how I can do that safely?
Of course. Staying active is very important for someone who has been diagnosed with hemophilia, since your bone and muscle strength are much less than someone who does not have it. Regular exercise can decrease your chance of bleeding along with maintaining muscle strength. The National Center for Biotechnology Information has suggested that before you participate in a sport or physical activity, you have a written plan on how to prevent bleeds while participating. This could be things such as wearing protective equipment or attending physical therapy as preventive measures.
I think I can definitely follow these guidelines and still be able to be active with my friends. So, what can I expect throughout my life with my diagnosis of hemophilia?
At your age now, you should really listen to your doctor and stay on top of your medications as they're prescribed. And what Mitchell said, keep doing physical activity to help reduce the effects of hemophilia. As you get older, there's a greater risk of falls and damage to your joints eventually if you don't keep on top of it. Bone density could decrease as you get older, and it's important to implement vitamin D into your diet and supplements as well. And you could catch some health problems early in these stages as you're younger before they get worse as you get older.
All right, that sounds good. Thank you for the information. Are there any resources in the community that you know of that I can get involved in?
Yes, there's plenty of different community resources. There's community locally and nationally. So there's a Do 5 initiative, which really separates hemophilia into 5 stages of your life. So when you start having a family, looking at the genetic portions of it, and as you get older, like we discussed, the bone damage. And as you're younger now, just being active and staying on top of your medications and living a healthy and normal lifestyle. We also provided a documentation from the CDC, a packet on how to get your medications, get education, and look up things related to hemophilia across the nation.
Thank you all so much. All this information really helped, and I plan on getting involved in these organizations to learn as much as I can about hemophilia and staying on top of my health.